Today, I speak on an issue that's both deeply personal and profoundly global: infertility. It is a condition that transcends geography, culture, and socio-economic status, touching millions of lives and challenging our health systems, our science, and our collective empathy. Infertility is defined as the inability to achieve pregnancy after 12 months of irregular, unprotected intercourse. According to the World Health Organization, infertility affects approximately 186 million individuals worldwide, with prevalence remaining remarkably consistent across low, middle, and high-income countries. The burden of infertility extends far beyond biological inability to conceive. It encompasses psychological distress like anxiety, depression, marital strain, and social isolation. Economic burden: high out-of-pocket costs for diagnosis and assisted reproductive technologies (ART). Social consequences, particularly severe in cultures where parenthood is tied to identity, status, and security. Population level implications: declining fertility rates in many regions raise concerns about demographic imbalance and long-term socioeconomic stability. Causes of infertility. Infertility is multifactorial, involving male, female, combined, or unexplained etiologies. Female factors include ovulatory disorders, for example PCOS, hypothalamic dysfunction; tubal damage; uterine abnormalities like fibroids, adhesions; age-related decline in ovarian reserve. Male factors: abnormal semen parameters, varicocele, endocrine disorders, genetic abnormalities, environmental and lifestyle exposures. Combined or unexplained: up to 20 to 30% of the cases remain unexplained despite thorough evaluation. Types of infertility. Primary infertility is inability to ever achieve a pregnancy. Secondary infertility is inability to conceive after a previous pregnancy. Subfertility is reduced fertility with prolonged time to conception. Age-related infertility is increasingly common as reproductive age rises globally. Diagnosis. A structured, evidence-based diagnostic approach includes female evaluation, ovulation assessment, that is serum progesterone, cycle tracking, ovarian reserve testing, AMH, AFC, tubal pregnancy tests, HSG, HiQ-SY, pelvic imaging, ultrasound, MRI when indicated. Male evaluation, semen analysis, hormonal profile, scrotal ultrasound, genetic testing when indicated. Couple-centered approach, Infertility is a shared condition, and evaluation must be simultaneous, respectful, and holistic. Treatment options: lifestyle and medical management, weight optimization, smoking, alcohol cessation, management of endocrine disorders, ovulation induction, surgical interventions, laparoscopic management of endometriosis, tubal reconstructive surgery, varicocele repair. Assisted reproductive technologies, ART, intrauterine insemination, IUI, in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI, donor gametes and surrogacy, where legally permitted. ART has revolutionized reproductive medicine, often offering hope where natural conception is unlikely. Recent advances. The last decade has witnessed remarkable progress. Genomics and precision reproductive medicine include pre-implantation genetic testing, PGT-A, PGT-M, whole genome and exome sequencing for idiopathic infertility. Cryopreservation technologies. Vitrification has dramatically improved oocyte and embryo survival. Fertility preservation for cancer patients is now standard of care. Artificial intelligence in embryology. AI-assisted embryo selection, automated sperm analysis, predictive modeling for IVF success. Regenerative medicine, stem cell-based ovarian and testicular tissue engineering, experimental gametogenesis. These innovations promise not only improved success rates but also more personalized, ethical, and accessible care. Future trends. Looking ahead, several trends will shape the future of infertility care. Number one, global recognition of infertility as a public health priority. Number two, expansion of low-cost ART. Innovations in simplified IVF protocols may democratize access in low-resource settings. Integration of big data and AI. Predictive analytics will refine diagnosis, personalized treatment, and reduce costs. Advances in reproductive genetics, gene editing within ethical boundaries and deeper genomic insights may address previously untreatable causes. Fertility preservation as preventive medicine. Oocyte and sperm banking may become routine for individuals delaying parenthood. Ethical and legal evolution. As technology advances, societies will continue to debate issues of success, equity, and reproductive autonomy. Magnitude of infertility in India. Infertility has become a significant public health concern in India, affecting millions of couples across both urban and rural settings. Recent analysis estimate that around 8% of currently married women in India experience infertility, with secondary infertility accounting for nearly 5 to 8% of cases. Broader population-based assessments suggest that up to 1 in 4 couples of reproductive age may face difficulty conceiving, reflecting rising lifestyle-related risk factors, delayed marriage, and increased awareness and reporting. The burden is unevenly distributed, with higher prevalence in urban regions where late childbearing, stress, obesity, and environmental exposures are more common. Social stigma remains profound, often disproportionately affecting women despite male factor infertility contributing significantly. Why fertility is declining in India? India's fertility decline is one of the most significant demographic shifts of the last few decades. The country has moved from a total fertility rate of 6.1 in the 1950s to around 1.9 in 2021, now below replacement level. Several interconnected forces are driving this change. Number 1, delayed marriage and delayed parenthood. 2, lifestyle-related infertility. 3, rising cost of living. 4, changing social norms. India has moved from hum do hamare do to widespread acceptance of single-child families, double income no kids, single income no kids. These shifts reflect evolving aspirations and lifestyle choices. 5, women's education and workforce participation. Higher female literacy and employment correlate strongly with lower fertility. Women are prioritizing careers, autonomy, and financial stability before motherhood. 6, urbanization. Urban families face space constraints, high living costs, and demanding work schedules. Urban TFR is significantly lower than rural TFR across states. 7, declining infant mortality. As child survival improves, families no longer feel the need for larger numbers of children, a classic demographic transition effect. 8, regional trends and policy impact. Southern and western states like Kerala, Tamil Nadu, Karnataka, Andhra Pradesh, Maharashtra have some of the lowest fertility rates comparable to developed countries. Family planning programs, awareness and access to contraception has also played a major role. 9, India approaching population stagnation. Government projections show India's total fertility rate may fall to 1.73 by 2035 and even lower in several states. This signals a long-term shift towards an aging population. Infertility is not merely a medical condition. It's a profound human experience. It challenges our science, our compassion, and our commitment to equity. As clinicians, researchers, policymakers, and our advocates, we must work towards a world where every individual has the right, the opportunity, and the support to build a family. The future of the reproductive medicine is bright, but its promise depends on our collective resolve to ensure that hope, dignity, and scientific excellence guide every step forward. ہندوستان میں بانجھپن ایک بڑھتا ہوا صحت عامہ کا چیلنج بنتا جا رہا ہے، ایسا مسئلہ جو صرف طبی نہیں بلکہ سماجی، نفسیاتی اور معاشرتی جہتیں بھی رکھتا ہے۔ حالیہ قومی تخمینوں کے مطابق ملک میں تقریباً 8% شادی شدہ خواتین بانجھپن کا سامنا کرتی ہیں، جبکہ ثانوی بانجھپن کی شرح تقریباً 5.8% بتائی جاتی ہے۔ بڑے شہروں میں دیر سے شادی، بڑھتی عمر میں حمل کی خواہش، ذہنی دباؤ، موٹاپا اور ماحولیاتی آلودگی جیسے عوامل اس مسئلے کو مزید گہرا کر رہے ہیں۔ دیہی علاقوں میں رپورٹنگ کم ہے، مگر سماجی دباؤ اور بدنامی کا بوجھ کہیں زیادہ شدید ہے۔ اکثر عورت ہی کو مورد الزام ٹھہرایا جاتا ہے، حالانکہ مردانہ عوامل بھی نمایاں کردار ادا کرتے ہیں۔ ابھرتے ہوئے رجحانات ایک بدلتی ہوئی تصویر پیش کرتے ہیں۔ آرٹیفیشل ریپروڈکٹیو ٹیکنالوجیز مراکز اب چھوٹے شہروں تک پھیل چکے ہیں۔ جدید IVF کی رسائی تیزی سے بڑھ رہی ہے اور ART بیسڈ تشخیص، بہتر سیمن تجزیہ اور انفرادی علاج کے ماڈلز کی کامیابی کی AI جینیاتی ٹیسٹنگ شرح میں اضافہ کر رہے ہیں۔ ساتھ ہی پالیسی سطح پر قابل برداشت علاج اور برابری کی رسائی پر گفتگو بڑھ رہی ہے۔ ڈیجیٹل ہیلتھ پلیٹ فارمز اور آگہی مہمات سماجی بدنامی کو کم کرنے میں مدد دے رہے ہیں۔